Sorry about that. So I want to welcome everyone today. What a difference a week makes in terms of weather. So we will be focusing in on Region 1, which is the South Shore of Metro New Orleans, in a few minutes. But as you remember, last week we were faced with Tropical Storm Arthur, and in the process, Region 9 had to bow out. Keith had to bow out because of pressing duties that were happening in preparation for the approach of Arthur. But I know Keith is with us today, correct?
Yes, sir. I'm here, James. Yes, sir.
And all of the information about Region 9 you can still find on last week's calendar invite. There's an attachment, and it's all of the slides giving you data about Region 9 in terms of patients and population and things like that. But Keith, I'm just wondering, in terms of the aftermath of Arthur, how did Region 9 fare? Are there any issues or any ongoing issues that hospice and home health agencies in your region need to be mindful of?
Well, there again, I know St. Tony Parish is online. I'm not for sure if Tangi's online, so I'll let them also speak on that.
Thank
But
you.
as far as I'm aware of, I'm not aware of any as far as issues, especially when it comes to hospital operations or nursing home operations. So I'm not aware of any issues. Of course, we all know there was a lot of roads that were flooded that may be a little bit too deep for a normal vehicle. I know I went through a lot of water myself. Of course, I got a big truck that sits up high. But anyway, and there were some places that was probably almost too deep for my truck. But with that being said, I'm not aware of any EMS issues. Of course, with Acadian, and ironically, we had a healthcare coalition call right before uh, Arthur. And Acadian, their policy is they won't go through more than 10 inches of water. So, but there again, I'm not aware of any hospital or EMS issues. Well, with that being said, I'm going to just break a little bit, and I could come back with some other information. I want to give the parishes any opportunity to speak.
Who's your spokesperson with St. Tammany that's on the
Okay.
call with us?
I seen Colin Semino. He's online. I can see
Hey,
Colin.
this is Collins. I'm
Hey,
online with
hey,
St.
Mr.
Tammany Parish.
Semino, thank you for jumping on.
No problem.
Are there any issues in St. Tammany Parish as a result of Arthur that hospice and home health agencies should be aware of this week? Any areas that were impacted with either, I don't know, we had 14 tornadoes, I understand, in Arthur. Any of those touched down in Region 9 or St. Tammany Parish?
Yes, we did have 3 in St. Tammany Parish, as far as the last count I heard. But the damage assessment teams have been out, cataloging all the damage, and the Public Works Department has been out picking up the debris. I'm not aware of any issues that would impact the home health or hospice agencies. We're doing pretty well on getting back the road to recovery, except for those persons who were directly impacted, and I don't think I've heard of any that were the home health hospice that it was affected those folks.
Okay. We might. Sounds like we have an open line somewhere. Let me see if I can close that. Okay. Thank you, Mrs. Semino. I appreciate that. Or is anyone on today's call on Region 9? Have y'all had any, found any problems in terms of delivering patient care on the North Shore? If you are, please unmute yourself or put it in the chat box, and we can address that right now. But Keith Peak is our Region 9 coordinator for the Health Coalition. So when we have issues, I usually run them through Keith, and then he takes it from there. Do you have anybody from Tangi that's on the call with us?
I don't know if Miss Vicky, are you on the call? I know she was in. I'm sorry. Go ahead. I don't hear Miss Vicky. I know she had she was in Baton Rouge at a meeting with LSU. So they're getting not to speak, too much for any parish itself, but anyway, kind of a general checklist that we always talk about every year as far as on the Region 9. In Region 9, of course, there's no placard required. The main thing is you have some type of official ID saying who you're with. They're getting if any of the hospice or home health agency nurses has any issues with reentry or traveling within Region 9, they could always call me and I could work with that OEP to try to make sure they have access to their patients and they're coming and going. Just as a FYI, in Region 9, of course, I know when it comes to home health and hospice, we're talking about adults, but just in case somebody may be taking care of some type of pediatric that is very electrical dependent. There again, we do have 2 pediatric daycare centers in Region 9 that are partners. There again, they'll provide a space and a plug for any severely electrical dependent pediatric. So if you come across, of that need, please contact me and we'll work it out. There again is a checklist every year. I always talk about oxygen supplies. More likely, we'll probably stage oxygen tanks throughout Region 9. With that being said, there's still a little grayish area where whether we're having pre-storm or post-storm, but of course we're having post-storm, but hopefully we'll have some pre-storm because generally speaking, that's the first phone call I get from hospitals is a lot of people showing up at the EDs looking for oxygen. So there again, also people showing up at hospitals looking for electrical plug. There again, as of right now, I'm not saying what may happen tomorrow, but as of right now, in Region 9, none of our hospitals are sheltering hospitals. We don't shelter the homebound or any home health or hospice patients at this point in time. That's something that could happen tomorrow. I know there is some conversations with a couple of different healthcare systems, but as of right now, I'm not aware of that resource being available. Now, with that being said, of course, like St. Tammany, like Tangi and other parishes, they'll have general pop more if the need is there. They'll probably have post-storm general population shelters. But of course, that's not a place for home health, especially for hospice. Now, if we pull the trigger, and there again, this is upon my leadership, we do have a medical special needs shelter in Hammond at Southeastern. We do a lot of planning around that, but we do have a medical special needs shelter. If they pull that trigger and open it up, it's able to take care of 100 patients plus 100 caregivers. Now, that's one of the criteria, and there'll be a triage number that you call. But there again, if they open it up, it has enough room for 100 patients with 100 caregivers, and it's mandatory that a caregiver comes with that patient. Now,
excuse me, but has that shelter ever been opened in recent times?
Yes, it was open during Gustav.
During Gustav.
That's the last time.
Okay.
Now,
2008.
It might have been open at other previous storms, but it might have been open at Katrina. I don't want to speak for that, although I was involved with I was at that point in time, I was doing this position volunteer and I was working full time at Sodom Memorial Hospital. But I do know for sure we did open it up during Hurricane Gustav.
Okay.
And at that time, St. Anne Parish also had, of course, they don't have a medical special needs shelter nor electrical dependent shelter. But at that time, they also had a shelter because I had worked on supplying nurses for their medical special needs shelter at that time during Hurricane Gustav. But there again, if we do pull the trigger, I definitely will let you know, Jamie, and we'll broadcast it. I'll broadcast it. I'll let you broadcast it to let folks know that resource is available.
Thank you. Thank you, Keith. I really appreciate working with you and having the connection, the contact information that we have between each other to get that information out to those providers especially servicing Region 9.
Yes. Because there again, and actually, Jamie, I sent you a document. I don't know if you could share it or I don't know if I'm able to share or not, but
with with population and all.
Yes, sir.
Yeah,
Yes, sir.
all of that information I have in the presentation that I did about your region last week.
Okay, okay.
Without you, it's all in last week's calendar invite, and anyone can go to last week, just open up the calendar invite, and you should see that attachment in there, and you can download it. It has all of the information with regards to the numbers of population and hospice patients, how many
Okay.
over the age of 65. We're going to be showing that same information right now for Region 1, but all
Okay.
of the information about Region 9 was put in last week's calendar. And I'll also put it in the Region 9 group
Okay,
after
that's great.
today's session.
That's great. Now, this is a little bit different information than what we already talked about, but it's good information. And like I said, I kind of took the spreadsheet. It's a lengthy, long spreadsheet, and kind of reduced it to smaller
Yes.
columns, less columns, and kind of explained a little bit about that data on that spreadsheet. And I can send it out, but we call it the Social Vulnerability Index. And the reason why I was going to point this information out because it's something we need to know. Okay, there again, you send out the at-risk registry every Friday,
Mhm.
but besides that, yeah, there may be some duplication, but not a lot of duplication. On that social vulnerability index, it kind of shows you the social makeup of your parish.
Right.
And there again, it's important to know that because you'll see the people that are 150% below poverty level. Households, like total households, how many, I'm talking about the total household as far as the income less than $75,000 a year. It goes to show you how many homes, how many as far as like condos and apartment complexes we have. It shows you how many homes have more occupants than beds. Also, but this is the important information is it shows you when it comes to the financial status, um, it shows you that a lot of folks may not be able to evacuate. You know what I mean? And so because
Can't afford it.
they can't. And not on that is also on that list, it shows you how many people that don't have vehicles. They may not have a vehicle. And of course, in Region 9, we don't have people like Region 1 has. Region 1 with the state, we have buses we'll send to Region 1 to pick up people to bring them to a point-to-point shelter or to another shelter. But in Region 9, we don't have that resource.
Yeah.
Also, it shows you how many people are living in mobile homes, which is very important. Like last week, as we know, it's not too safe to be in a mobile home during severe weather. And
Right.
so, it also shows you how many people don't have internet because I mean, there
Keith,
again,
I'm going to put that file in the Region 9 group, and people will have access to that information that you sent me. I promise, and I'm giving you access to it as well. So I need to move on from
sure.
Region 9 right now because I have some folks from Region 1, and a lot of our agencies, both hospice and home health, they service both North Shore and South Shore. So there's going to be a lot of overlap, and I want to make sure that the folks from Region 1 have an opportunity to give us their expectations of hospice and home care, especially over the coming hurricane season. And just for I gave this information for Region 9 last week, but these are the directors for Region 9 from GoStep, so that if you have issues, you might be able to find these folks to be of assistance to you. Louisiana just put out this really nice poster, and I was so impressed with it. I went and got it blown up, and I now have it hanging in my wall, so that those of you who are servicing multiple regions, this is a great poster in terms of contacts for this hurricane season. The telephone numbers for your emergency managers in each parish, as well as at the GoSef level and LDH level. It's great information, and like I said, I went out and had it blown up and turned into a poster that I have right over my desk, so that when there is an issue, I know exactly who and where I can call, and a lot of hospices and home health. You might find this very helpful tool in in your emergency management room. In terms of region,
Hey, Jamie,
yes, sir.
it may make one comment towards that.
Sure.
And those contacts are great. But the process, I'm just going to make this comment is, if you do call those other contacts, what they're going to do, they're going to kick it down to us.
Right.
Just an FYI. Other words, you could call a GoSep coordinator, but he's going to
right
kick
back to
it
you.
me.
Okay.
And rightly so, because
That's
we
good.
are ESFA, rightly so. That's our lane. So just as an FYI, the other contacts that you see on that list, they're great contacts, great people. I know a majority of them. But they're again, what they're going to do, they're going to actually they're going to forward it to us.
Because we're
an
considered
FYI.
ESF 8.
Yes,
And
sir.
this is an ESF 8, correct?
That is not ESFA, no.
Okay.
That anyway, just as an FYI.
Yeah. Okay. Okay.
Okay. All right. Thank you,
Well,
Jamie.
thank you. Thank you for the clarification. But region 1 is the southern part of
See if I miss anything.
Lake Pontchartrain. And these are your emergency managers in each parish. And then you just heard me refer to ESF 8. That's Emergency Support Functions 8. And I'm very, very fortunate to have on today with us folks that make up ESF 8 in Region 1 in Orleans Parish. Meredith, thank you for being here. I think Sarah is on the line with us as well from Jefferson Parish. I know Miss Goldfine is driving around somewhere in New Orleans, and Tom King and Javon, thank you all for being with us today to talk about emergency plans this hurricane season on the south shore of Lake Pontchartrain. Before going into, I just want to remind everyone, just on the south shore, on the north shore, you have about 600,000 people in Region 9. On the south shore, we have almost 8. You're talking about 1.4 million people in this part of the state. We have about over 150,000 people who are over the age of 65. On Region 1, we have about 8,500 deaths each year. Only 4,300 of them are in hospice, and each year about 3,000 hospice deaths. And then we have another 3,200 Medicare deaths that aren't on hospice. So, all of this is to say there are a lot of moving parts going on in Region 1 every day, let alone throw in some sort of emergency situation where those folks that we identified who are on today's call are going to have to deal with the aftermath and during it as well. In terms of Region 1, I went in there looking at the at-risk registry today, and I saw that we have 26 agencies in Region 1 who are using the at-risk registry. We have 6 agencies that haven't updated a total of 63 patients as of today, as of last Friday until today. 53 of those patients, of the updated patients, are missing weights, and that's the weight of the patient, which is an important part we're going to be talking about today, as well as missing 7 are missing zip codes, and 24 are missing date of births. In terms of what is this, Region 1 parish count? Oh, I went back and I looked at numbers from August of 2025, the peak of hurricane season last year, and then compared it to this week. And this year, we have 35 more people in the at-risk registry than we did at the peak of hurricane season last year for Region 1. That tells me that you all are doing a lot more. There was also 86 patients in there who were not updated last year, whereas only 58 are not updated this week. So just to give some statistics about what's going on in Region 1, so everyone understands the scope of the job of these emergency managers. There are currently 2,200 patients in the at-risk registry. 1,600 have been updated and 595 haven't been. We have 1,100 patients that are missing weight. 705 of those patients are the ones that are updated patients. And we have 206 patients with missing zip codes, 82 without birthdays. And the folks from Region 1 recently did a tabletop exercise. That was an incredible experience for Region 1. And Tom, Javon, you all were like the master controls for this, and I know Shayna, this was your exercise because you are actually in charge of moving all of those, providing the transportation. Y'all want to say anything about the exercise before we go move on?
Yeah.
Hey,
Oh, go ahead.
no, go ahead, Shayna. I'll go after you.
Okay. I was just going to say thank you to those who did participate in the exercise. I know we did call some people, and I'm sure you'll get to this, but I want to make sure that in a real situation, the numbers that are provided on the Excel spreadsheet that we get are the people who will be able to give us information about that patient and answer the phone during an incident, even if it is from an unknown number, because we're just going to probably be calling you from our cell phones. And so the information we'll need from you on the day of, if weight and everything is up to date on the spreadsheet, is are they expected within 2 weeks? Because that determines if we're going to bring them to a hospital versus a medical needs shelter. So just please keep that in mind during hurricane season. Happy to answer any questions also. Go ahead, Jovan.
Yeah, and to follow up what Shayna said and then kind of tie into what Keith was saying and in reference to this exercise. So for this exercise, Keith just expressed that we have the social vulnerability index that we sends out, and that gives us that snapshot of those individuals that are living at home that may or may not need some assistance. Then we get the snapshot from the home health hospice entities via the at-risk registry to give us a further snapshot. A few minutes ago, Jamie gave us a snapshot of, I think, 4,000 people alone that are at home on hospice. But if we just look at Orleans Parish, we have roughly 40,000 people that have been slated for some type of medical needs monitoring or medical needs sheltering. And our exercise that we did last month, I believe the days just kind of warping in. It was a 2-day exercise, and Shana was in fact that exercise director. And Tom and I, as our role as the ADRC with Keith in Region 9, our whole goal at that point was just to do that patient coordination, that information synchronization, looking to make sure that we have all of the information in the systems via the state system for patient tracking, and then also to the system that you guys use, the at-risk registry. And we're also to over that direct emergency point of contact. So like Keith says, you have the GOSEP coordinators on there. So I am of the mindset, as many numbers that you can have, because there's redundancy. So Meg is a coordinator in Region 1. But of course, any of us that Jamie put on the sheet a few minutes ago, Shayna, Meredith, myself, Tom, and Jefferson Parish, we will also be one of your contacts as well. So redundancy actually does help, because if one person is busy, the other person will be able to continue to assist, and we all work together. But what the exercise did was, like, for 2 days, and I'm not going to go into too much details, is that we wanted to see what it looked like for multi-parish coordination with all of our homebound people, whether they're just regular individuals that are home that have multiple comorbid diseases, or those that were on your list of the at-risk registry. And what we found that the gaps were, it was mostly communications, right? And so there was that communication gaps, and Shana just said it. So we have a list, and but on that list is not the updated entity. We may have DON, but that DON number may be the office number. And recall, if we have an incident like this, you guys are probably downsizing to a certain degree, not may or may not necessarily be in your offices. You're doing what you need to do to prepare and wrap around services. Also to the hospitals, and all of us on the line are doing the same thing. So we need to make sure that we have a backup number for, that's a number that would be answered, especially during this time, at least 24/7. So therefore, if myself from the hospital call, or if one of our parishes call for information, we will have that information listed as well. A few minutes ago, we talked about data entry, and we continue to say like wait and zip codes and what have you. All of that information is helpful because that weight and that age of that individuals allow us in terms of planning and in response mode to make sure that we have the available unit or the available assets, right? Whether that is extra people, extra vehicle, a specific ish vehicle, or if they're at a certain age, we can put them in a certain location, also to their cognition as well. So all of that was very that those were areas of opportunities. I don't necessarily say things that are wrong. Also, too, in the at-risk registry, when we don't have all of the updated information, you risk the chance of that loss of clinical continuity of care, right? And so they may be going to a shelter, a medical needs shelter that's not a hospital, or they may be going to a hospital, and we need to know that information. One other thing in terms of the hospitals is the last resort. The hospitals, in terms of sheltering, should not be your first line of actions when you, from the agency perspective, and also to when you're educating your clients and their family and or caregivers. The hospitals are there. They're just like everyone else. They're decompressing their hospital, and they're decompressing their staff, and they're only going to essential personnel. So if an individual that are at home that's part of your group, the home health hospice group, or admitted or brought to a hospital for sheltering under those extenuating circumstances, they may or may not be admitted to the hospital, which goes back into what Keith says, that making sure that we have a caregiver available. Another thing, lastly, one thing that I know that we don't always, at least I have not always heard, is that making sure that your clients have some either electronic or a folder that can withstand more order, that have those physician orders, the medication list, having at least 5 to 7 days worth of medicines available, especially when we're looking at storms. If we see something in the Gulf, get with your clients and the pharmacies to make sure that they do have some medication on hand. But other than that, I do know we have other people, so I will go ahead and yield to the floor right now. But ultimately, make sure within your agencies you have some sort of communication plan that when your front desk, your receptionist, or whomever answer the phone understands what's going on, and they know who to call to prevent any delay in transportation and for your clients. So I will go ahead and yield the floor if Tom needs to add something else. If not, I'll yield it to our parish folks.
And
Yeah, just
Yvonne, I was really shocked that the receptionist did not know who to refer those calls to, and there was that one timer that they were put on hold for 18 minutes before somebody answered, came back to give patient information. And all of that just delays this entire process. Tom, I'm sorry, I didn't mean to cut you off.
No, that's fine. I briefly, the 2-day exercise was a great success. So I just wanted to put that across. You actually participated with us for the first time, Jamie, and I appreciate that, because it's always good for everybody to see what the heck's going on with this type of stuff. And, it was a good slice of what does happen in the real world. Other than that, just to reiterate, all your patients, all the clients, they absolutely need to have their own cell phones, battery bank, so they can charge it just in case everything dies. And, you know, the hospitals are the last resort. So, but just keep that in the back of your mind. And a lot of the things that we learned, we're already addressing to make better. And that's all I got.
And one
Thank
last
you.
thing, that's what you said, Jamie, in terms of, because I don't want to shine a light that, you know, the receptionists, they didn't know, right? So agencies and entities may already have systems in places and plans, right? But sometimes the plans may be tucked away on a shelf in the corner. And so during hurricane season, I think it boils down to training. We do have I'm a nurse, and so there is a high turnover rate at times. And if that's something that you don't do on a regular basis, a training, I think this would be one of those caveats or those recommendations for the agencies and these providers, just to do frequent training and maybe a cheat sheet at the phone desk, so whomever's answering that call, they will understand. So I just kind of wanted to make it seem that I'm pretty sure there are systems and processes in place, but we need to make it more visible and easily referenced.
And
And
that's
that's
it.
it.
And thank you, Javon, for that clarification. And that's my point: is that when we think in terms of training on emergency preparedness, we need to make sure that everyone that's involved in your team, everyone that's involved in your office, understands the requirements around emergency preparedness, especially as we go into this hurricane season, which we're hoping is going to be low key. But I mean, last week was a preview of what is to come, so we'll see. Thank you, Javon. Let's see. I think Meredith, you're on today, right?
Yes, I'm here.
And you sent me your slides for the city of New Orleans. So I want to thank you for that. And you want to take it away?
Sure. Thanks, Jamie. And hi, everyone. So you can go to the next slide, Jamie, I think. Awesome. So just to kind of give some more context, I think everyone mentioned it, but so there has been some changes to the city of New Orleans systems under the new mayoral administration. And so one of those changes you'll see is that the New Orleans Health Department is slowly in process of rebranding to Health and Human Services. So under the direction of Dr. Avegno, our Deputy Mayor of Health and Human Services, she now oversees EMS, the public health and policy, youth and families, violence prevention, homeless services and strategies, and mosquito control. So we're a little bit bigger of a family, which is okay, but you'll notice some name changes and it may look a little different than what you've seen like visually in the past. Similarly, on the public safety side, the New Orleans Office of Coordination and Emergency Management is a rebrand, as well as NOCEP, if you previously knew them as that. And so, you know, they're working through that process as well, and there'll be more coming out about that over time. But they still are committed to the same mission around, you know, emergency management and special events work. They still have the reentry placarding process, although similar to what Keith mentioned earlier, a lot of that, you know, for medical providers in particular, if you have a credential like a badge or something else, or a letter from your agency that says, hey, this person works from, you know, at this agency, they're credentialed to work in disasters. Presenting that will usually work just as well, honestly. The placarding system is more for industries that don't really have those types of credentials. But, you know, that is something to just keep in mind, that you can apply for that through the One Stop app. It's at onestopapp.nola.gov. And then you click apply and you go to business reentry credentials. And so those are regional in nature. And so if you primarily work in Orleans, I would probably get it from Orleans. If you primarily work in Jefferson, or if you work in all 4 of the South Shore parishes, that's also fine. They are regional, so you don't have to get one from each parish. In terms of what was said earlier about emailing Derek, our new director of emergency management, a lot of plans, he's been getting a lot of them, which is great, but he has been forwarding them right to us. So it's just easier typically if you send the plans to pheeh@nola.gov. That allows our whole team to see them and be able to review them, update contact list and the like. And sometimes if they just sit in Derek's inbox, you know, he gets a lot of emails in a day. So he's always trying to sift through and make sure that the right people have the right contacts. So it's not that he doesn't care. It's just he's trying to triage all the different things and make sure that the information is in the hands of the right people. They do also still have their non-emergency line. So this is a good number to call if you have general preparedness questions, even about yourself or for your patients. So the 658-8700 number is great for their front desk. And then they can, pass it along to other folks as appropriate within their team. But then they also do have the 24/7 emergency line, which is, for their duty officer to answer. And that's more for those really acute incidents that maybe impact, let's say, like a facility or like a bigger area. That duty officer is usually one of the people coordinating. So again, we don't give that number out to the public because it's really meant for kind of those on-call emergent situations where you just need to get in touch with an emergency manager, very quickly. So no matter if Derek is out on vacation or anyone's out on vacation, somebody will be answering that number 24/7. So we don't put that out publicly, but it is a good one, in the worst case scenario to have. All right, next slide. So with the Health and Human Services Department, which is where I work, I'm the manager of the Public Health Emergencies and Environmental Health Division. Mouthful again, sorry. We always encourage that you can always reach out to me directly. I know Jamie had my email up there, but sending it to that PHEEH email also allows it to, be a 24/7 type of response, particularly in emergencies where hopefully I'm getting a few hours of sleep here and there, but somebody will be looking at that email 24/7. But we also included the cell phone numbers for me, Catherine, our field operations manager, Latoya, who's our community engagement coordinator, and then Ben Quimby, who's also on our field ops team. So typically these are going to be the folks that may or may not be in the EOC, but we usually send out a blast ahead of any event where we're activated for, multiple days with that schedule to Jamie. And, he's happy to share, I'm sure, widely with the group as well. So yes, I'm sure you will get a copy of the slides as well. I just saw somebody's question about that. Okay, next slide, Jamie. So at-risk registry updates, I'm sure this has been beaten to everyone's head, so I'm not going to spend too much time on it, but I will say that this is one of the major things that we use as a planning tool. The at-risk registry is something we get asked about from the mayor's team, mayor's comms. They're like, how many people are on that list? How many people have reported in? It's a highly effective tool in some ways because you all do have that direct contact with the patients and probably have seen them in their most recent condition. So, typically if we catch people or family members at an outreach event, we may see them once, maybe twice a year, but you are, more frequently in a home and seeing different stages of disease progression and all sorts of things. So as much as you can be updating those during the season, that is really helpful to us, like when those disasters hit, to be able to have the most accurate, most up-to-date information. Next slide. Okay, and so Orleans Parish emergency alerts, many of you are familiar with NOLA Ready. I know there's probably not a lot of education we have to do about them. I will add, texting NOLA Ready, one word, to 77295 is great. It also will send you back a link when you text that number and to sign up for text alerts, and it will allow you to fill out a complete profile for Smart 911, which is another way that families can prepare and individuals can prepare and indicate that they have additional needs above and beyond kind of the average person. So you can indicate that you have family members, pets, medical needs, you have, electrical dependency, that you need transportation during emergencies, all of that. So it's all integrated into the same system. So signing up for Smart 911 alerts allows you to not only just get the basic text alerts, but also if there are additional actions that are not going out maybe to the general public, you can also be kind of receiving those as well. So I always encourage people to sign up that way as well. But I will say if the person is already included in that at-risk registry list, it's really helpful because that will be kind of two of the lists that we'll be comparing to each other and kind of looking for those duplicates as we are planning for any sort of, shelter openings, transports out of the region, hospital, shelter kind of requests, things like that. So it never hurts to be signed up in multiple ways, but, generally speaking, we are using both of those things together when making those types of decisions during events. So like numbers wise, just like looking at number of people who have indicated a certain need, and we're comparing those two together. We also have text alerts in Spanish, so that is by texting ESP to 77295. And I always encourage, even if you don't live in Orleans Parish, if you are coming to visit us during, French Quarter Fest or Jazz Fest, or you work sometimes in Orleans, it's good to go ahead and sign up for them. I will say, I know that everyone remarks that we have a lot of alerts, and I get that. And so it can be a lot. Particularly since they've added in some of the missing persons alerts recently. And there's not a way to opt out of those while remaining in the rest of the emergency alerting process. But, that's just something that, unfortunately is kind of a community need and priority of the moment. And so it'll stay in place for now, but definitely sign up for those. It is a really important resource, particularly in those emergent events like tornadoes, hurricanes, and anything else that comes our way. All right, next slide, Jamie. And then updating contact information. I know that a lot of folks have sent in letters and whatnot, but if you're able to, or if you haven't yet sent in a letter of any variety, that's okay. It's always good to just kind of update your information with us. So I put a QR code in here to a short survey. It just has your name, your organization, and like the best point of contact, email, phone number. We use that regularly to update our healthcare provider list when we sometimes send out additional information, or maybe there's been a request, from, let's see, either the state or the mayor's team or anyone else who might ask about, what infrastructure has been impacted. So typically we're going to hit our local list with some of that, information to see if there's anything that we need to be aware of in that kind of needs assessment. Okay, next slide. Okay, and then I think that is it. Yeah, here's our shared email once again. So make sure you have that down. But yeah, I'm open for any questions, or we can pass it to Jefferson and do questions afterward. Either way works for me.
Thank you. Thank you for addressing the credentials for Region 1. And Keith, for Region 9, a letter is all people need if they're in healthcare. Their badge should suffice, right?
Yeah,
That's correct, Jamie.
Okay. I know. I'm just wondering if you all can help us understand what factors go into making the determination as to whether there's a mandatory evacuation or we're sheltering in place. Is there any place where you can see how that is determined?
Jamie, I'll let Collins speak for that. That'd be more his lane.
Is it by parish, or is it by region, or is it by state? I guess is the question.
Yeah, it's by parish, but you need buy-in from the state to be able to make that decision.
Gotcha.
Yeah, Jamie, this is Collins.
Yes.
It's a parish by parish decision. And, it's very situationally dependent. We're going to be monitoring the anticipated impacts. And if we see that, certain areas are going to be impacted in a life-threatening way, then we would certainly recommend to the parish president to recommend a voluntary, if not mandatory, evacuation. But it all depends on, every storm is different. It makes a huge difference, the different factors of the storm, the forward speed, the intensity, the direction it's coming from. If you've ever looked at the slosh models, each one has a different effect on the parish, especially the coastal areas. And we use multiple tools to try and forecast that as best we can, and to provide as much advance notice to the population, to the public, as we can.
Thank you. Those two questions that came to me earlier on last week that people keep asking me, that's why I'm asking you. Does anyone from home health or hospice have questions for the folks who have been on today's call?
Hey, Jamie, this is Jillian. Can I just give a real quick brief about Jefferson?
Sure. Oh, Jillian, I'm sorry.
Timing.
I didn't see you there. Yes, please.
That is okay. I am here for Sarah today. So although you guys saw Sarah Babcock's name on everything, our team is a small but mighty one of Sarah and myself and a few others who are very enmeshed with our EOC team and our crisis activation team for the parish because of the role that we play in evacuation and sheltering. So sometimes you'll get Sarah Babcock and sometimes you will get Joey Madison as
you.
your connection for anything. And specifically around medical needs registry, that's actually my forte. So what I wanted to see was, is there a way that I can just share my screen so I can show everyone
Sure,
how
hold
medical
on.
needs registry?
Stop sharing here and you can
Sure.
start sharing there.
Great. Let me see. Okay. So what I want to show everyone is, can you guys see the hurricane dashboard right now?
Not yet. Yes, now we can.
Okay, so if you were to type in jeffparish.gov/storms, the word storms, it will bring you to this page that I'm on right now.
Okay.
And what you can all see is that there's resources here at the bottom, transit evacuation plan and map, medical needs registry, re-entry placards, and the other things.
Oh,
So
wow.
can apply for your re-entry placards here if you want to, but where I'm gonna focus a little is on the medical needs registry. If you are actually updating your at-risk registry weekly and we get it, then this is not as big of a deal because we will, just like Meredith said, we will be using that registry that we already have from you and making decisions based on that. However, a person or a caregiver or a friend or a neighbor or anybody could click this button and it can be done on the phone. And it quite literally brings you into the registry to fill in names, all the information you would need about a human who would need help being picked up. And the address actually might not be, I don't know if you can see it, but once somebody puts in their address, there's a map, a place where I think you guys are covering it online, but it generates the actual address on a map. And that's really, really helpful for our EMS folks to have to look at so that they can see they've got 3 people in the same vicinity that need the same exact thing. They could potentially get them at the same time, depending on the needs of the person. So I won't go through the whole thing. You can see it asks quite a bit of questions. And then depending on your answer for certain questions, a drop down menu will come on. And it gives a place to even put your hospice, palliative care agency, and all the types of issues someone could have. There are choices underneath these, like under ventilator, yes, but then there's somewhere once you click it, it will give you the exact type of thing. It'll give you 4 choices for what kind of unit are you using. And then a place to put your comments. What's really, really important is that every single thing that has an asterisk by it, like where it says any pets, has to be answered. If it is not answered, it won't let you do this at the bottom, which is hit submit. Once you hit submit, it comes to me and I get it and I get all the information that you have just entered or whoever has just entered, and I review it and we make plans based on that. Like we already know how many people we have on hospice, how many people have to go by ambulance, how many residents are bariatric, et cetera, and so forth. So this is only based on what we have though. A lot of times when a storm comes, we get the calls in the middle of the storm. So what we're trying to do is get more people registered. Like I said, though, if you're doing your updates weekly, we will get them from Jamie. We have them. So
This
go
is
ahead.
this is more for the resident who's not on any type of service or not on home health or
You'd be
hospice.
surprised how
Home health
many
or hospice.
people I have on hospice on my registry
So these
and
are
or home health.
these
Yeah.
are folks that have signed up themselves because
Yeah.
the hospice has
Like,
not
a
put
lot of
them
time
on?
health agencies will call me and ask for how they can sign people up, and then they'll go in and sign 10 people up themselves that
That's it.
they're working with. So, I will go ahead and stop sharing, but I want to just let you guys know, again, how to get to it was right here on the jeffparish.gov/storms page, and it's this orange icon. So, some other important numbers to remember, and I'll put it in the chat also, is for us, yes, patients can call. If they call, that goes directly to my line. The only issue with that is that I'm not always in the office. So I sometimes have to call people back a bazillion times and vice versa, but we usually get it. That number is 504-349-1818.
I'm sorry, one more time.
504-349-1818. I'm gonna add a file, and well, you know what, Jamie, I'll send it to you, because I don't know
Yep.
exactly where it is right now.
Okay.
But we have a flyer that you can send out to everyone.
Thank you.
The other thing to remember is if you type in JP alert, which I'm putting in the chat, to the phone number 888-777, that signs you up for the exact same thing that Meredith was talking about in terms of getting alerts. We don't do as many alerts as JP, but that's just because protocols are slightly different. I'm saying, sorry, New Orleans. But when there are storms, there are definitely those that go out. So, based on time, I want to leave it so that you guys have time for questions, Jamie.
Thank you, Jillian. I appreciate
Sure.
that. Meredith, we don't have a similar sign up in Orleans Parish for folks to do. They have to call in and then you all input that information, correct?
No, they can do it independently. They can call 311 directly, and the 311 operators can do it, or you can go to I can write it in the chat. If you're not doing it from your phone, it's NOLA.gov/smart911 is the site.
NOLA.gov smart 911. Okay. Thank you.
Yes.
Okay. Any questions for Jillian in Jefferson Parish before we move on? Okay, I'm gonna move on. One of those important things that we learned during the tabletop was whether or not how we needed a new measure about the fragility of our hospice patients and whether or not they were transitioning towards an active phase of dying. And folks in hospice, and I'm sure in home health, understand what I mean when we say when they move into an active phase of dying. We put this new column in the at-risk registry for you to mark if they are. If they're not, you can just leave it alone. But if they are, just there's a toggle switch and you just mark it yes. And that's for those patients who are either actively dying, or they're currently non-responsive, they're transitioning, or they, in your best clinical judgment, if they're moving towards that active phase of dying. Emergency managers would like to know that before they actually get to the patient's home. So that's why we're including this this new. I want to remind everyone that we have these calls every Wednesday at 1:00. Next week we will be looking at Region 3, which is Southeast Louisiana. You can, if you have folks in your office who have not yet signed up for that particular one or any of these particular regions, you can do that. Or if you want to do the weekly call, just click on this hyperlink here, and it'll allow you to be part of every week. I want to remind LMHPCO and HICLA members and MAC members, if you're a member of the state organization, you now have access to these regional groups that we've set up for every region, every district in Mississippi, every region. We're signing folks up. If your service area is inclusive of those regions, you can sign up for as many regions as you want. I've now given our regional managers access as well to these groups, and you actually have management privileges so that you can send messages to everyone in the group, or you can upload files, and it's just a new way of communicating with the provider community in your region. So just wanted to let everyone know, if you signed up for it, you should see it when you sign in to log into the website. And emergency managers, you now have managerial privileges in those groups as well. There is a YouTube that we did not too long ago with regards to the at-risk registry. It's a tutorial. There's also a written tutorial that's available to you. If you need that, please feel free. Allison Allison Hughes in Region 2 provided these resources for folks to consider with regards to your educational needs with your families. We send out a report we send out a reminder to all of the users for the at-risk registry about doing the update on Thursday mornings and completing that before the close of business on Thursday, because every Friday morning we send out those reports that the emergency managers use to think about their planning for that week. I do want to remind everyone that CMS has just put up a new site called Getting Care in a Disaster or Emergency. You might want to take a look at. And next week, we will be meeting again on July 1st, and we will be focused on Region 3, which is Southeast Louisiana, the Bayou countries in the eastern part of the state. Before we close up, are there any questions for anyone? Any issues that you'd like to discuss before we let our speakers go? I see the chat. Go ahead.
Hey, Jamie, this is Javon. I just wanted to say to everyone, I know we talked about the special needs, the registry in Jefferson Parish and Orleans Parish, and there are great tools and resources. But I just want the providers to know on the phone as they're doing education with their family, when we and our partners, we're triaging these individuals, looking at these spreadsheets and their conditions. I want you guys to understand that they will be going to shelters, and these shelters are lifeboats, right? So those individuals that are on your list that you are aware that have the means and the capabilities to maybe encourage them, especially for those who have a large support system that encouraged family members to make a plan for their loved ones if they can. And so again, sign up for the registry. It is a resource that is available, but is a lifeboat. And so they will be in the shelter. So again, those family members that do have the capacity and the ability to take their loved one, they will fare better in those scenarios because they will be, in fact, with their family members and what have you. So that's all. Just wanted to kind of always like to share that with everyone.
I said hospice and home health, your responsibility is to help people develop their own plan and making that a workable plan with family members, with neighbors, with church groups, with organizations. If you can get someone to help take responsibility for the safety of this patient, your patient, that patient is going to be a lot happier than being transported to basically an open dormitory shelter somewhere in the state. And I don't have to remind you how fragile many of our patients are, and the stress of transporting, let alone the emergency situation, is going to have lingering effects upon your patients. So get family members to take responsibility. Get someone else to take responsibility for your patients in the event of an emergency, and make sure it's a workable plan before you throw them into the at-risk registry and ask the parish or the region to take responsibilities for these patients. Thank you, Joanne, for mentioning that. Any other comments or thoughts before we close up today's session? Okay, well, I want to thank everybody for your time and attention. I know you're very busy, and I want to make sure that we are doing everything we can to support your patients' safety in the event of an emergency. And I want to thank everybody in Region 9 as well as in Region 1 for being part of today's discussion. I look forward to seeing everybody in the next week. And in the meantime, stay safe.
Thank
Thank
you.
you. Thank you, Jamie.